Many of us will lose an hour of sleep this weekend when daylight saving time begins. Now, it can be tough on children as well, and many parents already are worried their kids do not get enough sleep. In fact, new research shows more than 18% of children aged 5 to 9 are being given melatonin, a well-known sleep aid, and more than 19% of adolescents take it as well. Let's talk about it with CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF. How you doing? Good morning.
Good morning.
All right, so is melatonin safe for kids? Let's just jump right in.
It does seem to be safe for short-term use, but there are a couple caveats there. Number one, it is a hormone. So whenever you're talking about giving kids hormones, you want to be especially careful, especially in kids who are prepubescent, so not yet adolescents. And then secondly, melatonin is not FDA regulated, which means that the rigorous clinical trials that we need for drugs that are FDA approved just haven't been done for melatonin. So we just don't have the same kind of data on the safety and effectiveness of melatonin.
Why does it work?
Yeah.
Well, melatonin is a hormone which regulates your sleep-wake cycle, so your circadian rhythms. So as the sun sets, as lights dim, as it gets later in the day, your melatonin levels go up, telling your body it's time to sleep.
Are there long-term health effects for children or adults? A lot of adults use it.
Yeah.
Yeah, we just don't have great data. There is some signal that melatonin use could trigger precocious puberty. Again, it's a hormone.
What is precocious puberty?
So you go through puberty early. You go through
like,
those
what is
hormonal
that?
changes early. So there's some signals that might cause that.
So I got to do a little cleanup on aisle 4 here. When I was introducing this segment, going to commercial break, I said I give in sometimes. I meant to say I would want to give in sometimes.
Oh, okay. I mean, no judgment if you do.
Katie,
Did your wife call you?
I do bedtime. Katie's home right now doing mornings, and I do bedtime.
She's like, what?
And she's gonna be like, what is going on in there? Okay, now, but I do open the medicine cabinet when we're brushing teeth, and I see, because we have melatonin in the house, because we'll take it sometimes.
Yeah.
And I thought about it. With younger kids, though, just it's not happening, right? What's the age that you would even consider giving it to your kids?
Yeah, I mean, some people are even giving melatonin to pre-K kids. So,
Really?
yeah, at very young ages. But again, I would really be cautious about using it in somebody who has not gone through puberty yet and use it even in teens on a very occasional basis.
With little kids, I guess the bigger worry actually is they're also gummies, right?
Right.
They look like candy. They are candy. They taste amazing.
And they can just get in there. What if a kid accidentally takes melatonin?
So the CDC has observed that over the last several years, we've seen a big increase in accidental ingestions of melatonin by kids, in part because you have these gummies. A lot of it involves the gummies.
And they're taken to the emergency room. So.
Yeah, and so fortunately, most of them do not end up hospitalized, but some of the signs that this could have been a dangerous ingestion include excessive drowsiness, confusion, hallucinations, seizures. So you can see some real side effects with this.
How do you release it naturally? If someone wants to take the natural approach and they don't want to take any drugs, is there a way to just help your melatonin release?
Because kids get the zoomies in the evening, and they're just running around the kitchen's a mess, banging cabinets and everything.
And Tony's like, where is the
And I'm like,
melatonin?
I got a frying pan. I'm like, whatever. Go to sleep.
Knock them out. Well, remember, melatonin levels go up later in the day as the sun dims, as lights go down.
Okay.
So just turning off lights and turning off those screens, which are blasting lights into your eyes, that can make a big difference.
Yeah, and also working for CBS Mornings, because we are always tired. Dr. Celine Gounder, thank you so much.